The spinal cord part of your central nervous system extends, of course, from your brain through your vertebrae all the way down your back, and off of it comes all of those peripheral spinal nerves that we talked about before. So the connections between your spinal cord, it's just this part right here is your central nervous system part. The rest of it is all support and protective structures, bone tissue, cartilage, meninges that we talked about, all of these intervertebral discs, everything to keep that central nervous system safe. It'll have cerebral spinal fluid for cushioning. It's got all of this going on because it is the highway from everything that is going on in your body to your brain and back again. Without it, we don't have that connection. If we take a cross section and look at your spinal cord here, we've already talked about that the dorsal brings in sensory, and the ventral side is going to send out motor responses or efferent responses. But you remember on your brain where the gray matter was? For your cerebral cortex, where's the gray matter? It's on the outside, right? We slowed down signal on the outside of your brain so we could process it, think about it, perceive things, understand things, and then we'd send a response back very, very quickly. Your spinal cord is opposite. The gray matter is in the center. And what we see on the outside is all the white matter. Remember, white means it's myelinated. Gray matter means unmyelinated. Why would we do this? Well, we're going to show you something known as a reflex arc. Reflex arcs are critical for maintaining homeostasis. Reflex, first and foremost, is involuntary. You have to keep that in mind. Everything we're going to talk about means that you have an autonomic or automatic, better put, reflex to what's going on. You burned yourself, you stepped on something sharp, you saw a bright light, you smelled something terrible, you pinched yourself, somebody punched you, you fell down. All of these can elicit some sort of automatic response to what is going on. The simplest pathway for a nervous response to occur is to go into your spinal cord and straight back out again. It never reaches your brain until after you have responded. Why is this so important? So in this case, pinprick, fine. The sensory information comes in the dorsal side. The motor response goes out the ventral side. Fine. But all we have in between is this interneuron. Long time ago, we talked about interneurons. Afferent with an A, interneurons, efferent with an E. That's the pathway. This is what we call a reflex arc. You poke yourself with a pin, you have moved your finger before you even know you're hurt. Why is this so important? We have to keep in mind that this is all survival. This interneuron is responding so that you don't get seriously hurt. Then it'll take the time to send the signal to your brain and go, hey, stupid, stop doing that. But in the meantime, you've already moved. You've already saved yourself from whatever injury you were getting. This is associated very much with something known as the stretch reflex. The stretch reflex, or what we call the knee-jerk reaction, looks at the tension on your muscles and adjusts when that tension is stretched quickly. So we see this sometimes during exercise, but you know it most often from the doctor's office when he taps you with that little hammer. This is actually sending a reflex signal to your interneuron, and you kick before you even know what's going on. Withdrawal reflex is the same thing. It's just another name for it. And this idea that you've touched something hot, the signal comes in through the dorsal side of your vertebrae, goes through the interneurons, and then the response goes right back out before the brain knows. That's the critical part.